So then once you continue, your page will look like this, and it'll say refine your plan results. And on this page is where you're going to select between looking at just a prescription drug plan or looking at an Advantage plan. So also, if you're looking at the system, once open enrollment starts, October 15th, where it says you are now viewing 2016 plan data, view 2015 plan data, it'll say 2017 and 2018. So you can, for new enrollees into Medicare, you can still look at this year's kind of timeline. It'll only show you 2 months or 3 months or a month, whatever they're looking at. Or you can look at 2018 plans and kind of see the plans for the future. So, next. All right, so this page is really fully what the page looks like, and these are the boxes that you're going to want to check. So, for just prescription plan coverage, if they are going with original Medicare, then you would select the top box, and then you'll just click continue to plan results. If they're looking at an Advantage plan, you will leave the top box unchecked and you will select the middle box. And then there are Medicare health plans without drug coverage, and I'm not really sure. I've never really used that box, so I can't tell you a ton about it, but it's an option for people if they want to look at it. And then on the side, these are optional filters you can use. Again, I'll be honest with you, I don't really use those. I kind of already am just looking at the system and kind of know what to look for, but these may be something you want to play around with when you're at your desk looking at the site on your own. They're just different tools to kind of narrow down the search, basically. So you'll select a box and then you'll click continue to plan results. So the second page just explains what the 3 boxes are in more detail, which I kind of already went over. Okay, so this is what the final kind of, not final page, but this is where you'll look and be able to compare between plans. So remember, don't click the back button. Don't do it. You're going to want to click return to previous page, because especially right now at this step in the game, if you click the back button, it is going to log you out and you're going to have to either re-enter if it's someone who you did a generalized search for, unless you wrote down that drug list ID number, you're going to have to re-enter all their medicines. That can be time consuming. So don't hit the back button, just hit return to previous page. Now on this page, it'll show your current plan. So it's always going to list original Medicare. Also, tell people not to look at that too closely. It's an estimation, not a guaranteed number, okay? Okay. And then, I keep wanting to scroll down. And then if they're under a coverage plan already, that'll also be listed. A prescription drug plan, that'll be listed as well. And then you'll scroll down a little bit further on the page, and this is what you'll look at. And the system automatically will categorize the plans into lowest estimated retail cost to highest estimated retail cost. So yes, the first plan that comes up technically will be the cheapest option. But you should always look, there's lots of things you should look at on this page. So, but that's how the system sorts it. So as a rule, just know that the first one that comes up tends to be the cheapest plan. Okay. So you're going to want to review the plan for the premium, the deductible. If their medications are covered, let me go back one page. So on this page, are they like on the same exact slides as us? Yeah, cool, thanks. But are they looking at the same slides? Okay. Sorry, technical question. So I'm looking at the page that says prescription drug plans, and then it has Magellan RX, Medicare, and Envision RX. So on this page, I'm going to talk about the things that you should be looking at, and I'm going to kind of point. So annual retail cost, this is your premium and your co-pays combined. And then the monthly premium, for Magellan's example, it's $34. And then over here is the annual drug deductible, which is $400. Now, when I'm explaining to clients, a lot of times they're like, $400? I got to pay that right out of pocket? And I'm like, kind of, but it's not going to be one lump sum unless you're taking a lot of medications that you get filled on the exact same day. Then it's possible it could be a $400 lump sum. And then the next column over, it talks about whether or not the person's prescriptions are on the formulary or not. If it says no, that means that some of their prescriptions are not on the formulary. And then also there are no drug restrictions. Sometimes plans will also have drug restrictions. You can't fill more than 120 pills of a certain medication in a 30-day period or something like that. And when you click on the plan, you can click into more of those details. So those are the things that you should be looking for when you're looking at this page. And then also, if you want to, you can compare 3 plans side by side. I always recommend clicking on the actual plan, looking at the plan, and then if you decide there's 3 after that, there's 3 plans you want to look at side by side to then do the side by side comparison, because it's not a full scope when you do the side-by-side comparison. Okay. Sorry. I had a little sick brain is what I'm going to call it today. So this slide is just saying that although they can enroll, we don't do any enrollments at the Office on Aging with our clients. We provide them with their options, and then we give the information to them. They leave knowing the options that they have or the plan that they're going to select. And on the printout that we give them, there's always a phone number. I'll show you guys that number. I don't have an example of it right this second, but I always give them the phone number to call and enroll. Calling it on the phone is very easy. It's not a hard process, but we always have them enroll themselves, or they can call Medicare, whatever the case may be. So, and then if they go past December 7th, they will be just automatically enrolled into their plan again for the following year. So it is important to be making any changes prior to December 7th, and it'll become effective on January 1st.